tell me a little bit about the type of people that suffer with tinnitus. What is tinnitus, and how do you assess them, and how do you manage a person who is suffering with tinnitus, misophonia, or hyperacusis?
Tinnitus, there are so many what we call aggravating factors for tinnitus, but the absolute general underlying cause for tinnitus is a loss of hair cell functioning in the inner ear, which means if you have any form of hearing loss in your inner ear, you are more prone to developing some ringing in your ears. But what's extremely interesting, which a lot of people don't understand or don't realize, is that we actually all have tinnitus. We're just not all aware of it. And this is why people say there's no cure for ringing in the ears, is because we actually all have tinnitus. So if someone said there was a cure, it would mean that they don't understand it. So what we in essence do is we offer something called CBT for tinnitus, which is cognitive behavioral therapy. We also offer something called TRT, tinnitus retraining therapy. And we do a combination of these approaches to help our patients to learn to live with their tinnitus in a way that their tinnitus no longer affects them at all. So the effect of their quality of life is reduced drastically through these approaches. We also work with things, it's really a global approach. We look at the aggravating factors like things like anxiety, depression, lifestyle factors like caffeine, stimulants, noise exposure. There are so many things, and we do it as an individualized approach. So we get to know our patient and we get to know what their story is. How are they experiencing this tinnitus? To what degree is it affecting their day-to-day functioning? And we design our program and our intervention according to that specific person. And the outcomes are absolutely unreal, how we can literally change a person's life over a couple of sessions to be in a position where they are not coping at all, to a position where tinnitus is a thing of the past, that they hardly notice it anymore, that they're able to habituate and push it aside. And that is just absolutely unbelievable to see that.